Hey YouTube, kiwee33 touching base from India. I didn't get to do an update yesterday. Um, Sleeping's been all weird and screwed up, so I went to bed, or my dad and I actually went to bed early, probably around 8 or 9 o'clock, and got up around 3:30 India time. So right now it's 4:30 India time. Um, No real updates to report. Things are just humming along. I had a bit of a sweating fit last night, which was good. The reason I say it was good is because I used to have them pretty frequently back home before I had the treatment done, and the last night was the first time I actually had one. So I don't know if it's. I want to say it's a good thing. Sign of a little bit of change, body flip flopping back and forth. So that's good. In terms of um, other things, I had a conversation with Dr. Gupta yesterday, and he actually gave me a better understanding of the ccsvi treatment, which I didn't really realize was the case, and also a better understanding of the usage of stents. Firstly, the usage of stents is Dr. Zamboni, who actually is the Italian doctor that made the discovery in November 2009, that was on W5 and that everybody saw. He's not even installing stents in anyone. It's just something that some other doctors around the world had picked up on and started utilizing, which seems to be, obviously really helping people. Dr. Gupta had outlined to me that the usage of stents should only be really, in his opinion, used in times of desperation, situations where people are in wheelchairs, lost body control, things like that. He doesn't really feel that I'm at, by any stretch of the imagination, that I'm at that point, being in a position of desperation or needing it, just due to the fact that my MS case isn't that bad. He thinks that ballooning is all that I need, which is obviously what I had done. So that's a really good sign. Good, not a good sign, but something that is promising to hear. What else? The better understanding of CCSVI that I've actually come to come to understand, and that was, as I said, explained to me by Dr. Gupta, was the fact that the procedure itself is not about maintaining or having the narrowed veins opened. It's more of having the blood moved that's been slowly circulating or moved around in the head, moved down into the rest of the body. Whether it lasts for 5 minutes, 5 days, 5 weeks, 5 months, it's really just trying to get that blood moving. Now, what he expects to see at the Doppler on Wednesday is he's really not too concerned with two lower spots on either side, but the upper spot on the right side, he expects to see that vein is most likely going to be restricted again, which he says that it happens all the time. It's just the way that it is. It's once again not about maintaining the vein being open, but just having that blood try to move through that vein. So once again, it was good to obviously get his professional opinion on it. So on Wednesday, we'll have a better understanding of where I am with the follow-up Doppler. What else? As I said prior, there's no real updates to report with me specifically. I think it would be one of those cases that's going to take a little bit of time, whether it be weeks or months for things to start changing. The other concern, or not concern, but the other thing of note is the fact that I'm relaxing at this point in time, just trying to get my body settled and get it right. And I'm sure once I get back into the swing of things back home, with the kids and my wife, we'll start to see exactly where I am once I'm back into a somewhat settled schedule. So that's pretty much it. I really don't think I have. Oh, actually, another item of note. Irish Bear 76 did an update the other day about blood viscosity and levels of stress. And it was funny because my dad is going through. He goes through a bit of blood, consultation, blood counseling, if you will. So exactly what Irish Bear 76 was saying is, I was able to make a connection between the two things. Irish Bear was basically stating that there is, during times of stress, which is where exacerbations come from, the blood thickens almost to, maybe even like a mucousy level. So the body spends more time trying to work the blood through the bloodstream and keep things moving. So heightened levels of stress will cause a slowdown in the blood moving through the body. And what I've found out or learned through my dad is there is a test. What's it called? PTINR that actually tests the levels of your blood viscosity. Just like in a car, 5W30, 10W40, and that's basically the thickness of your blood. There's a list of different vegetables which actually heighten levels of vitamin K, which is not what you want. You want to decrease levels of vitamin K. So I don't know. It's pretty interesting when you think about this stuff. Even after the surgery, one thing I actually forgot to outline is I'm on 5 days of subcutaneous needle injections for blood thinners, and I'm also on basically a 90-day supply of baby aspirin, which I'm actually going to continue taking to try to keep my blood level low, or my blood viscosity low. So it's definitely I think MS patients need to be weary of their blood levels in terms of the viscosity, the thickness, and try to keep the blood as free flowing as possible. So it's little discoveries, I think little connections here and there that we can make to try to help our situation. So that's pretty much it. Again, sorry for saying that again, but now I think that's pretty much it. That's all I really have to say for now. So we'll talk soon. Take care.